The Routine Task Inventory Assessment was developed by Claudia Allen in 1985 to assess how a client's cognitive abilities may affect the performance of daily activities. This assessment is most widely used in mental health settings, skilled nursing facilities, home health settings, and community programs for the elderly. This test includes 25 ADLs and IADLs separated into 4 categories: physical ADLs, community IADLs, communication, and work readiness. This assessment would normally take place over several sessions, so for this video I'll be demonstrating the administration of one category, the physical ADLs. The assessment is split into 2 parts, a client self-report and a therapist report, both of which are scored from 1 to 5. If the client has a caregiver, then a third assessment would be conducted with the caregiver. The lower the score, the more evidence of a possible cognitive impairment that is interfering with performance. I will now begin the interview and client self-report. Melissa, can you give me your full name?
Melissa Varela.
Okay. And is your gender female?
Yes.
Okay. And then how many years of education have you had?
Post-secondary,
Yes.
so far almost 5.
Okay. And what's your age?
22.
Okay. And are you employed right now?
No, I'm not. I'm a full-time graduate student.
Okay. What are you studying?
Occupational therapy.
Oh, great!
Yeah.
That's a future OT. Okay,
Yes,
sounds
yes.
good. Alright, so this is your home, so I noticed you have a few rooms in here. Do you have roommates?
I do. I live with 3 other girls that are in my program.
Okay, but they're not your caregivers or anything, right? You're
No,
living
no.
independently?
Yes, I
Okay.
am.
Alrighty. So for today, we're going to do this assessment called the Routine Task Inventory. And so we're just going to look at some of the things that may or may not be affecting you, see how well you're performing. And we're just going to do one part of it today, and we'll do the rest of the parts in a future session, okay?
Okay, sounds great.
Alright, so I'm going to give you the sheet, and you're going to tell me on a scale of 1 to 5, where do you think you fall? And you can read the descriptors for me and see what do you think you fall best into. So the first category here is grooming. So that's going to be taking care of your hair, brushing your teeth, doing makeup, whatever it is that you do to groom yourself. So where do you think you fall on a scale of 1 to 5?
I would say I'm number 5, initiates and completes grooming without assistance.
Okay, perfect. All right. So you can go ahead and mark that down. Okay. And then how about in the area of dressing here?
I would say I'm also a 5, selects own clothing and dresses without error.
Okay, all right. All right, so let's move on to bathing. How do you feel about that?
5 as well, bathes without assistance using shampoo, deodorant, and other desirable toiletries.
Okay. You're not finding any issues with any of these things?
No, I'm not.
Okay, perfect. And then how about walking and exercising? Walking, just be normal walking, and it can also fall under exercise.
I think I'm a 5 as well. Goes about new grounds or city and finds ways home, or follows a demonstration exercise program and learns requirements within 2 to 4 sessions.
Does that sound like you then?
Yeah, it
Okay,
does sound like me.
perfect. Alrighty. How about let's go into feeding. So here's the second part of that. And if you feel like you fall in between these two, that's totally normal. We can just cut you in half, 4.5 if you feel so.
I think I'm also a 5.
Okay.
Yeah.
Alrighty. All right, so how do you feel about toileting then?
I would say I'm also a 5, cares for self.
Okay, so you're pretty independent with that.
Yes,
Okay. And then do you take any medications?
I do.
Okay, so how do you rate yourself in terms of how you take medications?
I would say I am a 6, complies with new dosages, learns drug concepts, anticipates drug effects, and needs for refills.
Okay. And then you don't use any adaptive equipment,
I
right?
do not.
Okay, that's totally all right. So now that we've seen and sort of assessed yourself, now I'm going to actually observe you to do some of these tasks, and I will also put my score into consideration, and then we can work on some goals together in the future, okay?
Okay, sounds great.
All right. So we're just going to go over your daily routine and then see how these areas sort of fit into your life. So
Okay.
how about you show me how you get ready in the mornings?
Sure, so the first thing I do is I brush my teeth. Should I just go ahead and do that?
Yeah, sure.
Brush my teeth, kind of get the toothpaste.
Okay. Dental hygiene is important.
Very.
Melissa is initiating and completing all of her grooming tasks without assistance or any kind of cueing from the therapist, so I'm going to rate her a 5 out of 5 on the grooming physical scale. All right, Melissa, so why don't you just go ahead and show me how you might pick out an outfit for the day and how you would get dressed.
Okay, so I usually take into consideration what the weather is out today. Today it's pretty warm, so I think I'm gonna probably wear something that's kind of light. I think this romper would be fine.
Okay.
So
Gotcha.
should I try this on?
Yeah, sure.
Okay.
I see you have a lot of different colors in your closet.
I do. I like the color sometimes, depending on the time of day, honestly.
Gotcha. Melissa is demonstrating independence with the dressing ADL. She's selecting her own clothing and is dressing without any errors, paying special attention to the colors that would match, and dressing appropriately for the weather. So I would score her a 5 out of 5 on the dressing portion of this scale. All right, Melissa, so I understand that you probably just ate, so we're just gonna simulate how it is that you would prepare something to eat for yourself, okay?
Okay.
Alrighty, so what food are you planning on eating today?
I'm thinking of something kind of light and snack. I set out this orange earlier.
Okay.
I think I'm just gonna dig into it.
Okay, sounds good.
So I usually cut up my orange.
Very refreshing on a hot day like
Yes,
this.
Definitely love oranges.
Do you eat snacks like this kind of often?
Yeah, for the most part I do. Yeah. Would you like a piece?
Melissa again is demonstrating complete independence with her feeding ADL. She is considering the size of her food portions. She's picking out foods that contribute to a balanced diet. She is also able to cut her own food, opening different containers, as well as offering food to others around her. In this case, it was the therapist. So I would score her, again, another 5 out of 5. All right, Melissa, so the last thing I'm going to observe with you today is how you would take your medications. So why don't you go ahead and show me what your process is with that.
Yeah, sure. So I actually only take one type of medication. It's B12. I looked it up. Basically, just gives you energy and really helps you function on a day-to-day basis. I decided why not to just take one a day. And I usually take one after I eat, so I just have that snack. And so now I'm just going to take one with my water.
Okay, perfect. And there's no side effects to the medication at all?
No side effects. When it comes to the taking medication task, this is on a scale of 1 to 6, 1 being
also completely dependent and 6 being completely independent, I would score Melissa as a 6 because she is able to comply with her dosages. She is scheduling correctly. She knows exactly when to take her vitamin B12, and she knows all of the side effects of the medication. She also was able to realize that her medication was running low and that she needed a refill. So this is going to be a number 6 for independence.